Okay, folks, we're gonna get going here. Okay, so looking at the schedule, I'm going to be going through a couple things this afternoon. I commented on them earlier, but I wanted to provide an introduction to them first by talking more broadly about this term, oft overused, frequently hyped, but pointing to something of substance, which is big data. And we're going to be specifically talking about big data in the context of health behavior, and cognate areas of human behavior. So the term is a cluster concept that often refers to a set of frequently electronic data sources. Thanks, enormous. A set of electronic data sources which are listed before you. We're going to be talking about several of those, including the first two and the final one. But broadly, within the past decade, particularly because of the growing sourcing of information electronically, the emergence of electronic health records, but also electronic management systems for lab test results, imaging results, for point of sale records, for purchases, the growing emergence of sequence data, both in terms of proteins and in terms of genetic sequences, so nucleotide sequences, in terms of gene expression data over time, communicational behavior. There's been a real upsurge in the amount of information that bears on an understanding of health behavior that is available electronically. And when it comes to health surveillance, when it comes to understanding patterns of health out there, there's a wide spectrum of opportunities to choose from different data sources. And we're going to be talking within this afternoon's lecture about several points on the spectrum. On the one hand, discussing from issues as coarse as monitoring search behaviors associated with individuals' use of search engines to find information online, proceeding through monitoring of social media channels, particularly self-publishing platforms like Twitter, and then talking about mobile data collection, spending a significant amount of time with the ethical system that collects data from smartphones and these days from a growing number of wearables. The spectrum here is one that is shown deliberately for a purpose. So we have on the left-hand side here somewhat coarser insights, less longitudinal resolution at the level of an individual, although often longitudinal at an aggregate level, and it's less flexible. But at the same time, it's recommended by lower recruitment challenges. We're dealing with secondary data that we can analyze. On the right-hand side here, we have finer insights. And it's more flexible, but also there's need often to recruit individuals to studies and to run studies in a way that will retain their adherence. I noted this morning that a important definition of big data, which is in my mind sort of the least bad one that I've yet seen, which points to big data being distinguished by four primary characteristics. By volume, yes, that's the big and big data, but also I noted by velocity, the fact that it's coming in quickly over time, the fact that it's high variety, so it relates to a set of different factors, often rather than just one factor on its own. and that often it picks up with physical measures things that are subject to dicier self-report, either due to reporting bias or recall bias or other factors, but also because it allows for sort of triangulation. It's notable that these middle two, velocity and variety, are particularly shared with system science models. System science models depict behavior over time at a fine-grained level, and often depict a wide variety. Alex, if you would mind getting the door partially closed there, thanks. Also, they capture typically a fair degree of variety in what's captured. They're not stovepipe models that focus only on one thing, but rather an interconnected set of factors. And in system science models, we're seeking to probe the underlying situation in a way that we aspire to in terms of veracity. So let's just briefly walk through these things as a lead up to covering three of these methods. So in terms of volume, traditionally, when we've run epidemiological studies, often the number of participants is far larger than the number of records per bits of information per participant. With big data, we will often have a reversal of that, where the number of pieces of information per participant exceeds the number of participants in the study. That's not always the case. We always like to have higher N as well to get a broader swath of society, et cetera. But there's no question that when it comes to collecting things like accelerometers, but also things like GPS traces, factors such as step counts over time, incoming and outgoing calls, browsing behavior, you might have a very large number of records per participant that are featured. From the standpoint of traditional epidemiological volumes of evidence, you're talking about very large volumes of evidence, dozens of megabytes per day per person. Still less than you might get with a teenager on Saturday morning downloading YouTube videos. It's dwarfed in size, and that's an important point because data plans that accommodate YouTube surfing often will accommodate the needs here very readily for connecting it from smartphones. But it's still a very large volume of data compared to traditional sources. And what's particularly notable is that the volume of data that we're dealing with here often requires different handling techniques, different methods for analyzing it that are amenable for traditional systems or recommended for traditional systems. And that does mean different means of storage and analysis and visualization. Methods that we've used on small data sets often don't scale to this size. But often because of the volume of data, we look for methods, for example, from visualization that might otherwise not be needed with traditional data sources. I want to highlight that there's a certain quarter of scientists who will point to this last feature as the defining feature of big data. That it's we have to it's distinct in an operational level that we have to handle it differently, and I'm cautious of that because that changes with technology over time. So often out of these studies, we'll get millions and millions of records for a period of a couple months of monitoring. This is one study with where we had approximately 50 individuals, I believe, through the School of Public Health, and we were getting tens of millions of records across multiple measurements. Volume is the most obvious one, and it's one that people talk a lot about. But I've argued that more interesting for our purposes is the issue of velocity. This data is often coming in at a rate that dwarfs the rate of arrival of traditional data sources. And it does span a variety of rates. There are certain types of wearables. For example, the accelerometer on a Fitbit, for example, where you might be getting quite a few measurements every second that go into the measurements. And it is possible that with gyroscopes and accelerometers on phones that you can also get, that sort of level of resolution. We certainly get certain measurements on the order of seconds, GPS devices perhaps every 30 seconds or every minute. And for other measurements, say Twitter messages or Facebook updates or browsing behavior, et cetera, might get many a day, et cetera. But this is a lot better than a quarterly self-report, or it's a lot more frequent than a quarterly self-report. And an important point here is that the variety provides high temporal resolution into micro behaviors at a level that are not sampled by self-reported measures, which are more aggregate in character. So rather than asking, in the past 60 days, how frequently did you visit the grocery store, we actually get pictures of their visits. Or instead of asking how frequently did you use e-cigarettes versus cigarettes in the past month, you actually get a picture of what people are using on an ongoing basis in terms of sessions of cigarette use. Or you get a picture of when they're actually taking their HIV, highly active antiretrovirals during the day, rather than just sort of reporting on how frequently did you remember to take them or what have you. So you get a very high temporal resolution picture. And that picture can be related to what we depict in models, which is also often at a fairly high temporal resolution. It turns out that for reasons we'll be returning to on Thursday, high velocity within a system science context often itself delivers high variety. Now that sounds bizarre, but suffice it to say, and I'll leave it till Thursday, that when you have very high resolution data sets and you have an underlying complex system that's coupled, knowing about one set of data with very high resolution will whisper to you about what's going on across many areas of the system. Okay. It will tell you something, if you listen for it, about what's happening in many different areas of the system. Particle filtering helps us get to the root of that, and the techniques associated with this convergent cross-mapping technique we'll talk about Thursday help us point to this. But variety at its most obvious level is also an important feature of these data sets. So, often we'll have a given data set that provides multiple types of information. So what we'll be looking at this afternoon with Ethica, where we capture location, physical activity, proximity, perhaps, humidity levels, responses to ecological momentary assessments from the same basic source for similar time same person. It gives a variety of insights. Or consider smartwatches, maybe the Fitbits with which Ethica is now set up to use and read data directly into it, where you can measure sleep and you can measure step counts and you can measure heart rate for the same person over time. Okay. So increasingly for a given participant, we have multiple sources of data available from these different measurements, from a smartphone, from a smartwatch, from knowing about their location and how it exposes them to weather, from weather-related information, maybe point-of-sale purchases and Facebook updates. So for a consenting individual who's willing to share some of this, it provides a kind of multi-dimensional picture on what's going on that can then be often analogized to what we're getting from models and can help us point to help challenge or support modeling evidence. And what's very important is this evidence is cross-linked. So it's for a given participant in a given time, we'll often have multiple types of information. Okay. So we get this kind of multi-dimensional picture of their communicational behavior based on their context and their physical activity as it's influenced by those around them. So we'll get pictures, conceptually like this, where, for a given individual, we may have them engaging in behavior such as bathing behavior on a beach, and there's measured risk ratings for that section of the beach at different times where they are exercising, and therefore to which they're exposed. There may be advisories posted or even closures posted, which they're not listening to in terms of their bathing behaviors, and perhaps they have highly credible gastrointestinal illness reported at certain points. And we can see this kind of picture of day-to-day patterns that is elicited from multiple types of measurements. Sometimes self-report, say on phone, sometimes as measured by environmental sensors or by sensors off of water quality samples, like the measured risk rating, and then data from other sources, perhaps posted online, such as beach closures and beach advisories. So you get a picture over time of what's going on. Or maybe with respect to vector-borne illness, such as tick-borne illness, we'll have a picture of when a particular individual removed a tick, when they reported a rash, characteristic perhaps of Lyme disease, when they encountered a Lyme disease advisory, when different levels of symptom appeared, and when they sought care, as determined by GPS or by self-report. So we can get these kind of views of the trajectory or biography of an individual by knitting together often different types of information on them mediated by different devices. And so we can get these kind of linked pictures of, activity level over geography of our city, or where people are engaging in social interactions during and after work, as measured by proximity sensors on the devices, coupled with GPS sensors from the same phones. Within computer science, there's a rule that was coined after the inventor of Ethernet, Bob Metcalfe, which has been termed Metcalfe's law. And basically it argues that the value of a network rises not linearly with the number of people on the network, but with the square of the number of people in the network, super linearly. So if you double the number of nodes in a network, you have more than double the value delivered. And I would argue that it's somewhat like this for cross-linking data. By cross-linking data, often we can elicit something that's greater than the sum of the parts. It's not just we get two extra types of information. It's rather they can feed together to give a consistent picture of certain underlying behavior. We'll see that during the week, and we will see this in the form of some of the discussions with Ethica. The final component is veracity, and part of this is physical measures. We know since the NHANES 3 study that there's big gaps in self-report between what people report for physical activity and what they in fact engage in for physical activity as measured by physical sensors. For nutritional intake, there's a similar gap between what people report and what in fact they do in terms of servings of fresh fruits and vegetables or sugar-sweetened beverage consumption or what have you. Weight, there's also a disjunction between what people report and what's actually measured through physical measures. And when it comes to measuring these things, one of the interesting aspects of big data sources like smartphones is that often we can measure them more accurately and with less burden on the participant by doing so automatically, say from a weight scale that sends the information via Bluetooth, or by having a person snap a photo of food rather than trying to describe what it is that they're eating once a month. Or we can measure with an accelerometer their level of physical activity on a wrist-mounted wristband rather than having to ask them how much physical activity they get. And we can get back something that's more accurate than they would self-report and less burdensome than they would traditionally deliver. So those ones I mentioned, physical activity and sedentary behavior, aspects of people's dietary intake, for example, these are just one of many. Similar things with location, a big difference between where people report being and where they actually are measured as being with GPS. In terms of contact patterns, our work suggests that often it's so burdensome to report contact patterns that it impoverishes, without a lot of compensation, the ability to collect data that way. But you can gather a lot of that information with automatic measures through Bluetooth beacons these days, etc. So when it comes to a lot of different factors, communication, social context, spatial proximity, physical activity, and sedentary behavior, location, decision-making rules, self-reporting is often challenging in its accuracy and its burden, and yet often these are key considerations when it comes to informing our models, when it comes to informing our techniques. So within this week's sessions, we're going to be talking about techniques that can lessen that barrier by allowing recording at low burden and comparatively high accuracy, things that would otherwise might be prohibited. This is an example of contact duration, which we've measured, contact length between different individuals. This is measured on a variety of data sets. The first and the final two are from our data. We've done dozens of these studies that have included some measure of contact. And the Cambridge one is a different data set. But we can get this picture of how long people's contact durations are, how their social networks or their networks as induced by proximity change from week 1 to week 2, for example, in a way that might bear on their on the risk to acquiring a communicable disease or in sharing of norms. And we can allow for reportings of foods, physical activity, and barriers to physical activity. Now, so the point here is that individual measurements can sometimes be more accurate than self-report, but collectively, often we get a particularly strong picture. So often we can use multiple measurements, say an accelerometer and screen state and heart rate, to infer things like sleep level at a much better level than we could with self-report or than we could with just one measurement alone. Or similarly with stress levels or posture, or whether someone's indoor or outdoor, in vehicle or not, or whether they're smoking or not. Often by combining multiple ways of measuring things, we get this kind of multidimensional picture that with right machine learning algorithms allows us to pick out with high confidence what the underlying state is. Although any one measurement is highly fallible in this inference, jointly together with a tool like a hidden Markov model or a tool like deep learning, you can often zero in on what the underlying situation is. The individual measurements are very uncertain, but collectively they have a real verdict that they give as to what's going on. So, health big data that we're going to be focusing on this afternoon. Some of its salient characteristics. Tends to be intensively longitudinal, available at an individual level. It's often accompanied by physical measures of certain things, location, proximity, etc., physical activity. We can often link it to responses to ecological momentary assessments, characterize behaviors, but also exposures and outcomes along multiple causal pathways. This is very important. So for example, we can ask, how does the presence of a service dog affect sleep quality for a veteran, but also how does it affect their likelihood of being spending time outside the house, their likelihood of social contact, their likelihood of engaging with other veterans. To what degree is it leading to more structuring of their day-to-day patterning? We can capture these sort of things that are otherwise hard to quantify. It has sufficient temporal resolution to really lessen the impact of recall bias compared to some surveys asked, say, once a quarter or once a month. We can ask in the course of the day about their recollection of their affect or about their challenges. And we could recognize many day-to-day patterns. And then the capacity to triangulate. And because a lot of it is automatically collected, it's lower burden. So these are some aspects of health big data that we're next going to explore. Okay? And we're going to be focusing for the balance of the afternoon on 3 major types of health big data. The ones addressed here: search monitoring, Twitter monitoring, and mobile data collection. Okay. Any questions related to this material before we dive into these specifics and we start to look at particulars? Questions? Okay, great. So what we're going to do now, having closed that, I'm going to ask you to fire up a browser, and we're going to go through a set of these data sources. So I'll stop this as well.